Few days of the Nairobi summit on ICPD 25, the biggest question remains, what next? What did this conference mean for the country, and why should we care? Dorcas Wangira reports.
The dust has settled after the Nairobi summit on ICPD 25. The real work begins. But what does this mean for the world, and especially 47 million Kenyans in whose soil up to 1,254 commitments were made on population and development issues?
The Nairobi Statement, a transformative agenda-setting framework based on the Commission's recommendations. UNFPA will regularly report on the 12 global commitments embodied in the Nairobi Statement. UNFPA will create a new high-level commission to drive this agenda.
What are they?
Zero preventable maternal deaths, zero unmet need for family planning, and zero harmful practices.
Women continue to die when giving birth. We continue to face incredible level of child marriage. Millions of women who really want to have access to, family planning.
There's one thing this summit has done is taken the elephant in the room and put it squarely on the table. We will not reach zero preventable maternal deaths and injuries if we do not address the need for safe and legal abortion services.
Other resolutions also included political and community leadership to address inequalities in sexual and reproductive health rights, innovation and technology to meet the promise of Cairo, and partnerships with governments, regional bodies, international organizations, civil society, CBOs, people with disabilities, religious leaders, the private sector, and even celebrities. This will cost up to $264 billion to achieve. The European Union and allied countries have pledged $101 billion.
I therefore commit to inform all and educate my community to be merciful and eradicate all forms of discrimination.
Kenya's commitments are ambitious. A young, unemployed population is a ticking time bomb. Achieving the 3 zeros would mean increasing the health budget. That is not more than 5% of the national budget as is, to lower the maternal mortality rate.
I would like to restate my personal commitment and that of the government of Kenya, together agree to eliminate female genital mutilation, which remains one of the most serious violations of human rights of women and girls.
Hatusikii ni vipi ataifanya. Unajua kuna kusema kitu na kuna pia kupangia na kuna kutoa pia resources ama kutoa zile fedha ambazo zinahitajika kufanya hiyo kazi.
As countries go back and work on the plan of action, UNFPA's high-level commission will work with its partners and focus on a decade of delivery.
SRHR is a win-win concept. Churches have been, are, and can be part of the solution.
Already, a United States delegation has said that it will not support any international framework on the ICPD 25, expressing its reservations on sexual and reproductive health rights. For Kenyans, the recommendations, if implemented, could mean a better quality of life for a better managed population. The stage has been set in the next few days for advocacy that will also mean necessary and uncomfortable conversations. Dorcas Wangira, Citizen TV, Nairobi.